Venous thromboembolism, is also known as VTE, is the most common cause of preventable deaths in hospitals. Accordingly, medical prophylaxis against VTE has become a standard of care. Patients with advanced liver cirrhosis often have deficiencies in clotting factors that leave them at increased risk of bleeding. Consequently, they may not be considered appropriate candidates for prophylactic anticoagulation. However, these patients may also have deficiencies in factors that inhibit coagulation that may leave them vulnerable to VTE. And in fact, there have been studies which have shown that liver disease may increase the risk of VTE. There are, however, other conflicting studies which suggest that advanced liver disease is protective against VTE. Previous studies have not assessed the risk of VTE that is associated with liver disease, specifically in a hospital setting, where the risk may be highest. We conducted this study to compare the risk of VTE during hospitalization among those with liver disease and cirrhosis to those without any liver disease. We used hospitalization data from the nationwide inpatient sample from the years 1998 to 2006. We identified hospital discharges with a diagnosis for liver cirrhosis and further categorized them as compensated or decompensated liver cirrhosis. We then formed a comparison group that comprised a random sample of all hospitalized patients without liver disease. In our analysis, we found that the risk of VTE among liver cirrhosis patients was largely dependent on age. Those with compensated cirrhosis who were younger than 45 years had about a 23% higher odds of having TE during hospitalization than hospitalized patients without liver disease, after adjustment for factors such as sex and comorbidity. Those with decompensated cirrhosis had a more pronounced 39% higher odds of VTE. After age 45 years, the increased risk of VTE associated with liver cirrhosis disappeared. Our study highlights the previously unreported finding that age modifies the effect of liver cirrhosis on the risk of VTE during hospitalization. Some of the conflicting data in the literature may be partly attributable to not taking into consideration the age of the study population. Importantly, our data suggests that liver cirrhosis is not protective against VTE in the hospital setting, and that those with cirrhosis should not be excluded as candidates for VTE prophylaxis. Cirrhotics younger than 45 years should especially be considered as long as they are not having significant active bleeding. Even those older than 45 years should be considered for VTE prophylaxis on a case-by-case basis, since they have similar VTE risk to those without liver disease.